inflammation tends to be somewhat systemic, not in all cases, but there have been studies that have found that inflammation in the gut can lead to either inflammation or the brain, or if not inflammation in the brain, can lead to symptoms like anxiety and depression in the brain. Hey everyone, welcome back. Let's discuss if probiotics might be able to improve mood more in a woman than hormone replacement therapy. Certainly, it's known that hormones impact mood, but when you're struggling with a symptom, if you're a woman and you have anxiety, depression, PMS, and you're trying to figure out, why am I feeling this way? What can I do to fix this in my body? Probiotics may be an underappreciated aspect of improving mood symptoms. And let's look at a case from someone with which we were consulting. Her name is Amy, and she was working, as you see here, with Dr. Scott Spartigliosi from our office. And Amy was a 55-year-old menopausal female who was suffering with depression, anxiety, also gas, bloating, loose stools, abdominal pain, and insomnia. So certainly being menopausal and having insomnia, depression, and anxiety would throw up a flag that female hormones might be implicated. But let's look at her case so that we can learn what Amy needed. And as a quick aside, you've probably heard me say something along the lines of, there's rarely kind of this one silver bullet that resolves all of someone's issues. But if we can get 2 or 3 very well crafted recommendations, oftentimes we'll pick up roughly 30% per intervention. And these 2 or 3 things will bring someone from, let's say, on a scale of 1 to 100, they rate their health at 30 or 40 and they want to get to 100. Well, if you get a 30% level of improvement from roughly 2 interventions, that's going to bring you 2 or 3 toward that 100% or close to it. And this is a great example of exactly how this plays out in the real world with a real person. So first, we start off with the question, could her gut symptoms be connected to her mood? And if you've been following my work for a while, you probably know there's a lot of evidence showing that this can definitely be the case. But as I also say, don't take my word for it. Let's look at this meta-analysis of over 2,000 people. And they found that those who had digestive symptoms, this broad category known as functional gastrointestinal disorders. So this includes not only IBS, where there's discomfort and either constipation, diarrhea, or both, but it broadens out and also encapsulates dyspepsia, indigestion, heartburn, pain, constipation that's not from IBS, right? So all of these things. And by the way, this category, FGDs, functional gastrointestinal disorders, affects about 40% of the population. So there's a good chance if you're watching this, you or someone you know are suffering from a symptom like this. And the key finding here is that those with digestive symptoms had higher likelihood of anxiety and or depression. Okay, so there's the connection. Now, coming back to Amy, her prior treatment was an estrogen patch and progesterone capsules. After 3 months of hormone therapy, she noticed improvements in her sleep. Great. However, no change in her depression, her anxiety, nor her gastrointestinal symptoms. So we advised her, Dr. Scott namely, on a Lactobacillus bifidobacterium blend probiotic at 112 billion CFUs per day. Fairly standard intervention. You've probably heard me discuss before that there are 3 general types of probiotics: blends of Lactobacillus and bifidobacterium, a Saccharomyces boulardii, which is technically a fungus, and also soil-based probiotics. So we started simple with just the one. And after 2 weeks, only 2 weeks, what did she notice? And this was actually surprising to see how quickly these symptoms resolved, but there was a resolution, as she reported, in depression, in anxiety. She had healthier bowel movements and she had less abdominal pain. Not surprising when you understand the literature showing the the connection between the gut and one's mood. But let's outline this again, not taking my word for it, but looking what the evidence has to show us. So firstly, let's see if gut dysbiosis, disruptions in gut bacteria, connect to mental health with a meta-analysis looking at over 2,700 individuals. And to quote, compared to healthy controls, Patients with depression showed increased levels of zonulin and lipopolysaccharide. Zonulin tells you you have leaky gut present, and lipopolysaccharide is what leaks through. We've discussed before how this triggers, amongst others, this pivotal receptor known as toll-like receptor 4. Continuing, elevated levels of gut dysbiosis markers were associated with severity of mental symptoms like depression. So clearly there is a connection between what's going on in your gut and what's going on in your mind or with your mood. So let's continue and sort of make this hopefully a little bit more visually relatable with this schematic, showing that dysbiosis or other disruptions in the gut can lead to increased leaky gut, and that leaky gut then correlates with inflammation and also with depression. Because remember, inflammation tends to be somewhat systemic, not in all cases, but there have been studies that have found that inflammation in the gut can lead to either inflammation or the brain, or if not inflammation in the brain, can lead to symptoms like anxiety and depression in the brain. So this then begs the question, if there's this cascade of what's happening in the gut, then can lead to leakage, inflammation, anxiety, and depression, can intervening with a probiotic start to resolve some of this? Firstly, by resolving dysbiosis, right? If dysbiosis or disruption in the gut is the first domino, can probiotics help that? And yes, enter a systematic review of 63 trials. Now, whether the population being examined was healthy or had some sort of disease, they both had disruptions or dysbiosis in their guts documented, and probiotics were shown to lead to anywhere from roughly a 50 to an 80% resolution, or at least improve the status of the microbiota. So whether healthy or diseased, probiotics had a favorable impact on that dysbiosis on the microbiota 50 to 80% of the time. So this is the first domino, but let's see if it connects further to the question of, can probiotics improve mood imbalances? Because we have to tie this all the way to feeling better. So enter a meta-analysis of 1,900 patients, and to quote, the beneficial effects of probiotic on depressive symptoms were significant in patients with major depressive disorders. So we're seeing high-level summary data, meta-analysis of 19 trials, 1,900 patients, that probiotics improve mood if you have depression. And one of the final points I want to leave you with here, by Gruger and colleagues, and we've discussed this before in neurogastroenterology and motility, Bifidobacterium longum at 1 billion per day led to an 82% resolution rate of IBS symptoms, a 61% improvement in depression and anxiety, reduction of inflammation, like we've already discussed. But here's the other thing I want to tie in that connects the hormonal piece, not female hormones, stress hormones, but there was an improvement in what's known as a cortisol awakening response. Now, what is a cortisol awakening response? If you're tired, mopey, depressed in the morning, it could be because you don't have enough cortisol to get you up and get you going. Sometimes cortisol is vilified. If levels are vastly too high, sure, but I think more often what happens is this stress maladaptation of the output of cortisol. And this is what you're seeing here. They plotted that cortisol awakening response. Again, what gets you up, helps give you energy during the day and positive mood. And then on the back half of the day, you should be able to sleep better if you have robust cortisol during the day and correct cortisol at night. You've probably heard some of the Hans-Selye stress model of adaptation is that under prolonged stress, and your gut can be a stressor, you will see the rhythm of cortisol level output be disrupted. And this can lead to being tired and maybe low mood during the day, and then not being able to sleep at night, right? So in this graph, you're seeing for individuals with poor sleep, poor energy, and IBS symptoms, at the start, they had a suppressed output of cortisol. They then started on the Bifidobacterium probiotic, and what you see is a normalization of their cortisol awakening response at week 4, continuing through to week 8. And these cortisol improvements also correlated with improved IBS symptoms, improved mood, and improved sleep and energy. But continuing with the graph, you see that normalization of the cortisol actually goes down, and they have a reduction of their healthy output of cortisol to week 12 and to week 16. They had stopped using the probiotic at week 8. So this shows us that many of these things tie together. Your gut health, your cortisol levels, your mood, and your sleep, and that at least one intervention, probiotics, can improve, which is exactly what we saw in Amy's case, leading to a few of these lessons learned. That female hormone symptoms, anxiety, depression, insomnia, may be caused by subpar GI health, and we documented this correlation between IBS and female symptoms. Mechanistically, the gut is connected to mood via inflammation. And then interventionally, most important intervention, GI therapies, namely probiotics, but not limited to, can improve dysbiosis, reduce GI symptoms, reduce inflammation, balance cortisol, and remedy mood symptoms. So, if you are a woman suffering with symptoms of female hormone imbalance, don't forget about the importance of probiotic. Now, it's not to say it has to be all hormone support or all probiotic, but discuss this with your doctor as an option that may get you over the hump. Because the one thing I'm glad we were able to prevent Amy from doing is going on more hormones or being more aggressive with how her hormones were modulated. And this gentle and safe gut therapy improved her gut symptoms, but also her mood. So remember that the mind and the gut are connected, and probiotics are one support that can be helpful. All right, guys, talk to you next time.